All right, class. So today in this lecture, we're going to talk about the cranial nerve number 5. That's trigeminal nerve. So before we go into the details of this nerve, there's one thing that I need to tell you. Okay, whenever you're covering any cranial nerve, these are the things that you need to know. You need to know the nuclei of the nerves. Then from nuclei, there arise the roots that you need to know. Then after the root, the moment the cranial nerve exits the CNS, that point is known as emergence, which we have pretty much covered in neuroscience when we were covering brainstem. And then you need to know about the course, and that course is always divided into the intracranial part of the course and then the extracranial part of the course. And along the course, they're also giving the branches. And then you need to know how this nerve is going to terminate, right? So these are the headings. When you cover these headings for any particular cranial nerve, then only you can say that you have covered the entire cranial nerve. So we're going to follow the exact same pattern with this lecture. So these are the headings that I've just talked about. Let's just start with the nuclear. Now, when we talk about the trigeminal nerve, that's the fifth cranial nerve. So it's basically, as you know, it's functionally it's a mixed nerve. That it has both this function, that it's a motor nerve as well as it has a sensory root. So when we talk about the nuclei of the trigeminal nerves, there are 4 nuclei which are present at different levels of the brainstem. First one is known as the main motor nucleus. The second one is known as the main sensory nucleus. And then we have the mesencephalic nucleus, which is basically present at the level of the midbrain. That's why we call it as mesencephalic nucleus. And then we have a spinal nucleus, which can go all the way to this upper portion of the spinal cord. So these are the 4 nuclei that we have of the trigeminal nerve. Let's go into the details of the different nuclei. So in this diagram, this is a diagram from Snell's. You can clearly see the 2 main motor as well as the sensory nucleus of the trigeminal nerve. This is the main motor nucleus of the trigeminal nerve, and this is the main sensory nucleus of the trigeminal nerve, and they're present at the level of pons. You can clearly see it. Similarly, you can also see at the level of the pons, the lower part of the mesencephalic nucleus right here of the trigeminal nerve. So these are the nuclei which are present at the level of the pons on the posterior aspect of the deeper layers. And this is the diagram that describes the spinal nucleus of the trigeminal, where you can clearly see it right here. So we have the mesencephalic nucleus, which is present closer to the midbrain. Then we have the main motor nucleus right here. They have the main sensory nucleus somewhere right here. And then we have the spinal nucleus of the trigeminal, which is right here, the upper portion of the spinal cord. So all of the nerve fibers which are coming from these 4 nuclei, they finally converge. These are known as the roots of it, and they converge and they form one nerve, which is known as the trigeminal nerve. So when you talk about the trigeminal nerve, this is another diagram that tells you about these nuclei. So these are the principal sensory nucleus right here. The motor nucleus will also be right here, and this is mesencephalic nucleus, this is spinal nucleus. They all combine together and they form the trigeminal nerve right here. When we talk about the emergence, let me show the emergence first. When we talk about the emergence, so you all know that the trigeminal nerve, it basically emerges from the anterior aspect of the pons, which we covered in the brainstem. So that's the emergence of it. Now when you talk about the course of it. So the moment the trigeminal nerve, as soon as it basically exits or the CNS, it emerges from the CNS, it has a ganglion within the cranial cavity that's called the trigeminal ganglion. And from the trigeminal ganglion, 3 divisions of the trigeminal nerve, they arise. One is known as the V1, V2, and V3. The V1 is known as the ophthalmic division. The V2 is known as the maxillary division. And the V3 is basically known as the mandibular division. As you can clearly see it here, the green one is basically the ophthalmic division of the trigeminal nerve, responsible to supply the eyeball And then we have the blue one, which is the maxillary division, which is responsible to supply the face around this area. And then we have the mandibular division, which is responsible to supply the lower part of the face when it comes to sensory root. But when it comes to motor root, these muscles, these divisions are responsible to supply the muscles of mastication. So as far as the sensory root is concerned, this is the territory that we can actually tell from the scalp till the forehead and till the tip of the nose. This is all supplied by the ophthalmic division of the trigeminal nerve, sensory root. The area towards the upper jaw and the lower part of the nose and the upper lip, this is supplied by the maxillary division of the trigeminal nerve for the sensations. And coming from the lateral side, like a temporal and the supratemporal area, and then eventually covering the entire lower jaw till the chin. This is covered by the mandibular division of the trigeminal nerve, sensory root. When we talk about the branches of specific divisions, so I'm just going to talk about the ophthalmic division. So it gives the frontal branch, it gives the nasociliary branch, and as well as it gives the lacrimal branch. Now, these are the branches that you have already studied in the orbit, and all these branches, they are actually passing from the superior orbital fissure to enter the orbital cavity, as you can clearly see it here. Apart from that, if you talk about the maxillary division, it basically gives the zygomatic branch right here, and then it gives other branches as well, which we can clearly see there. So everything that you see in green is basically given by the ophthalmic division, and everything that you see in orange is given by the maxillary division of the trigeminal. You can clearly see the maxillary division is coming right here. It exits through the foramen rotundum, enters into the infratemporal fossa, and here it basically gives the zygomaticofacial nerve right here. It can give the infraorbital nerve, which passes from the infraorbital foramen, right, and supplying the different parts of the upper jaw. And everything that you can see in this diagram in blue is basically the division of the mandibular division of the branches of the mandibular division of the trigeminal. And here you can clearly see it's giving this nerve, which is going up here, known as the auriculotemporal nerve, supplying the lateral part of the scalp. Similarly, it gives the buccal nerve right here, which goes and supplies the buccal mucosa. Then it gives another nerve which exits from the mental foramen, known as the mental nerve, supplying the lower part of the face closer to the chin. So these are the nerves that you need to know about, which are the branches of these divisions. So this is just a summary of it. So from the first division, we have the supraorbital nerve, the supratrochlear nerve, the intratrochlear nerve, the external nasal as well as the lacrimal nerve. From the V2, we have zygomaticotemporal nerve, zygomaticofacial nerve, and infraorbital nerve. From V3, we have auriculotemporal, buccal, and mental nerve. Now, the great auricular nerve is something which is given here, which directly comes from the cervical plexus. So it has nothing to do with the cranial nerve or trigeminal nerve. It's formed by the cervical plexus, which is formed by the spinal nerves. So this was all about the trigeminal nerve. Please remember, as far as the functionality is concerned, the sensory root of the trigeminal nerve is going to supply the face for the sensation. So whenever जब भी कोई face पे touch होता है, pain होता है, temperature feel होता है, anything, that is all carried out by trigeminal nerve along with its divisions. While on the other hand, when we talk about the motor root, so the motor root is basically responsible to supply the muscles of mastication, responsible for chewing. So this was all about the trigeminal nerve. If you have any question, you can ask me. Thank you.